Hey everyone, welcome back to the Dr. Taj Show. I'm very honored to host today's episode. I am Casey Callanan. This is, of course, Dr. Taj. Why don't you just introduce us and tell us a little bit about what you do?
Well, I'm Dr. Taj, also Dr. Kambiz Tajkarimi. I'm a board-certified urologist and cosmetic surgeon in Northern Virginia.
Today we're talking about penile implants and penile enlargement. And I want to know, first and foremost, tell us about it, and is this safe? What's going on right now?
Well, many men, they are not fully satisfied with the size of their penis, and the multiple studies have shown that they prefer larger girth. A lot of men are unhappy with the girth of their penis, and a lot of men have retracted penis. They are unhappy with the state of their penis in the flaccid state. They feel like it's retracting. I only perform the implants by Penuma. I avoid fillers and fat injections. I know there are a lot of places out there, a lot of non-doctors injecting fat and fillers into the penis. I believe that these are potentially dangerous and also non-permanent type of procedures that may cause a lot of scar tissue. The penile implant by Penuma, or the new implant procedure, I've been doing the procedure since 2021. Okay. This procedure is the only FDA cleared medical device for penis enlargement. I use this device frequently. I do perform about 5 to 12 Penuma or implant procedures per week. We have patients come traveling from all over the world. It is a silicone-shaped block that's custom fitted to enhance the girth of the penis. Mm-hmm. I make a small invisible incision in the scrotum that heals beautifully, so it's a concealed type of device.
Got it.
We basically add about 2 to 3 inches to the flaccid length, and at least 1 to 1.5 inches to the flaccid girth. When patients develop an erection, the penis will double in volume in majority of patients and gets a lot thicker. It doesn't change the erect length, but it increases the volume of the penis. Women in general enjoy thicker penises than longer penises. The procedure has risks. Any surgery has risks. There's risk of bleeding, there's risk of infection, shifting of the implant. With the newest techniques that we have developed with the 8 surgeons that are out there right now in the United States, we have minimized the infection to the same level of infection rate as the penile prosthesis for erectile dysfunction, to less than 1 to 2.5%.
What are your patients telling you afterwards? What kind of feedback are you getting? I'm really curious about that.
The best candidate for a penile prosthesis is a patient with realistic expectations. We tell them what's going to happen, and they don't have unrealistic expectations. They need to understand that they need to be mentally prepared for about 6 to 8 weeks of recovery where they cannot perform sexual activity, no masturbation or sex. They need to just let it settle and heal.
Yeah, for sure. You just mentioned, Dr. Taj, that people come to see you from all over the world. Tell us about where you're located for those that are not familiar. Tell us about how they would find you.
Well, we're conveniently located outside of Washington, D.C., about 10 minutes from Dulles International Airport in Leesburg, Virginia. We have a very structured clinical pathway. Patients arrive the day before. They can stay at a hotel, and then there are hotels around us. They come and have the surgery. They can take an Uber or go with their family members to the hotel, come back next day, and 3 days later they can travel back to their destination.
All right, and as I do on all these Dr. Taj episodes, I give Dr. Taj himself the final word. Is there any other final thoughts you wanted to leave us with about today's discussion?
Our goal in my practice is to help men and women feel better about themselves, look better, and also make love better. And that's the motto of my practice, is improving quality of life in the bedroom and beyond.
Dr. Taj has been our expert today on the Dr. Taj Show. I'm your host, Casey Callan, and I want to thank you all for tuning in. And Dr. Taj, most importantly, thank you for your time today.
Thank you so much for coming by, Casey.
It's been my pleasure.